by the Ad Council and the Centers for Disease Control and Prevention.
Good morning for another minute yet. Northeast Radio SD, Watertown, South Dakota. Live, we've got some special guests with us today. We've got from the, can I say the village of Harmony Hill? Is that the right way to say it? Okay, very good. Let me turn these things on here. There we go. Now I've got everything ready to rock. So, Krista Beauchamp, you are the Senior Living Administrator.
Correct.
I say that right?
Yep.
Yes. Okay. And then Fancy Espland. Did I say that right?
Correct.
Yes. You're the Assisted Living Nurse Supervisor.
That is correct.
Chair. Okay. So this is cool because what we're talking about today is it's like a My Care line, right?
Yes.
Okay.
Yep.
Give me like a kind of a nutshell about this, because when I was reading about it, you got all sorts of kind of some technology in there and it's good stuff for everybody, really.
It is, absolutely. So at the Village of Harmony Hill, we have memory care, assisted living, and independent living. Currently for our assisted living residents and the assisted living and the memory care, we offer My Care line. And we started on this in September. At the Village of Harmony Hill, we partner with Good Sam and Sanford for our healthcare services. So they help manage our services in respect to healthcare. And so this was an initiative that they have for My Care line. And so what it allows us to do is after hours, so in the weekends, evenings, overnights, our staff are able to call a nurse that is dedicated to solely the My Care line and able to help triage different situations. So maybe we had a resident that fell or has developed some respiratory symptoms or has a wound, or the staff just have a question about medication maybe. They're able to call this nurse that's just dedicated to them, that can first do a phone call visit with them. And through that phone call visit can maybe answer their questions or help assess the situation, but we'll triage it. And if needed, they can elevate it to doing a visit on an iPad with the nurse. So the nurse can maybe do not really face-to-face, but a visit like that with the resident and see and maybe do an assessment. And if they felt it necessary beyond that, they would be able to use a TytoCare machine. And so that would be a visit with a mid-level, so like a nurse practitioner or a physician's assistant. The TytoCare machine has a stethoscope so that provider can remotely listen to the resident's lungs. It has an otoscope so they can look at their ears. It has a assessment camera. So maybe if there's a wound they need to do a good assessment on, they can visually see it. There's a tongue blade on there. So if they need to look at their throat. And so then that mid-level is able to do that assessment right there in the comfort of the resident's own home.
Wow. And so you mentioned that it's complementing primary care. It doesn't replace primary care. So how do you ensure like the data from like a 2 a.m. virtual visit reaches the residents' regular doctor the next morning?
Yeah, so the My Care line nurses have access to our medical records, so the information for the resident. So they're able to look at their meds, they're able to look at their diagnosis, they're able to look at their vital signs, and they are able to document all of that within our documentation system. They also do a documentation note in Epic, which is the medical record system for Sanford that's used and most commonly used in hospitals. And then they do a progress note that is either faxed or mailed or sent to the physician. So it is communicated. And absolutely, this is not a replacement of their primary care physician. It is just a supplement for the residents and the staff for after hours care.
Okay. So let's talk maybe a little bit about resident comfort. Research suggests care in place improves well-being. Have you already seen a shift in like resident morale, some of the stress levels now that they don't have to face a late night ambulance trip for non-emergencies?
Yeah, so I will start. I think, so we always have a nurse on call. That's a little bit of the difference of assisted living versus a nursing home. We don't have a nurse there 24 hours a day. So I'm also a nurse. Fancy's a nurse. So we take turns taking call. And we've seen a decrease in the number of phone calls that we have received because they're able to call that nurse on call who is readily available. So calling me at night and waking me up at 2:00 in the morning is different than calling a nurse who is sitting there waiting for a phone call. Mm-hmm. But yes, if we have a resident that falls, for example, and maybe they're complaining about their shoulder hurting or their arm hurting, that nurse can do that assessment right there, and where our med aides aren't able to do that assessment. And if the nurse, deems that everything is okay, then then they don't have to go to the hospital. So those are some of the success stories that we've had, that they can do that assessment right there in the video, and then we don't have to have them go out.
And so you talk about managing the partnership. The village is managed by Sanford Health, Good Samaritan Society. How did the partnership facilitate the rollout of My Care line across the campus?
Yeah. So this was part of a pilot within Good Sam and Sanford. So it was actually rolled out not only to our location, but to the other Good Samaritan locations in South Dakota. So we're excited to be part of that pilot and, offer our experience with it too. So we can offer areas for improvement, what's going well, areas that we see need in. And so that's been exciting for us that we've been able to be a part of that. As an assisted living, we offer high acuity care. So we even look a little bit different than some of the traditionally owned Good Samaritan locations. And so it's been exciting for us to pilot this and be part of their virtual healthcare initiative.
Mm-hmm. So, Fancy, if you're a nurse supervisor, you've probably seen a lot over the years, I would imagine, dealt with a lot. So with something like this, is it something that you see people, grasp onto right away, that they latch onto, they want to check out and learn about, or is it something they're kind of apprehensive about right away? Or
I think in the beginning, there was some apprehension about it, just because it's a nurse that they don't know. But the good thing is it's a very small group of nurses. There's 4 or 5 nurses that are managing it right now. So oftentimes they're talking to the same nurse. So they're getting to know our residents and our staff at the same time. And, I think it's reassuring for our staff because, like Krista said, you wake one of us up in the middle of the night and it takes a minute to get your brain going, where these nurses are sitting at a computer with their chart pulled up and they can readily access that and answer questions. If they're saying they've got a wound that's bleeding, let's say they fell and, have a cut on their forehead. Head wounds bleed and that can be scary. But if you have a nurse that can look at that over a webcam and say, okay, let's apply pressure, like it's, I'm right here with you, that's reassuring.
Yeah. So, and then we talked a little bit that it does go to the primary doctor, but you can look at that information if it's something that you would have to follow up with since you're there. You get to access that information and you're right there the next morning to, hey, how's everything going? I would imagine.
Absolutely. They're charting right in our computer system in our charts. And so we have access to that right away. So we read those progress notes, we follow up with the resident and their family.
So I'm not sure who, but maybe someone talked to me about this intergenerational mission a little, because I know that, what you deal with and is a little different. But so talk a little bit about the campus has kind of become a hub for all ages, but you see virtual health technology like My Care line. Do you see that eventually playing a role in some of the intergenerational programming that you see out there?
I think that virtual healthcare, generally speaking, it's going to expand. This is just the beginning of it. I don't know what role it will play in the intergenerational. I think at some point we'd love to expand this to like our independent living and different areas. So I think there's a future there. I'm not 100% sure what that looks like, but definitely. And yeah, as you alluded to, we have the learning center on campus. And so we've enjoyed having the kiddos come over on a regular basis, working with them. And we also have our residents that go over there and hang out with them too. So I think a couple weeks ago, they went over there and they held babies, which is pretty awesome for our residents to be able to do that.
Oh, no way. And so you also talk about, you guys are kind of a leader. You got deep roots in South Dakota. You're dealing with a lot of development things. You're looking forward for the future. What, where do you see like a digital transformation with virtual healthcare? Do you, are you taking AI classes? Do you talk about AI? Do you see that playing more of a role with, I don't know, what you do day to day?
Yeah, absolutely. That's something that we've talked about. There's so many different things that you can use in regards to AI to help us, even just as predictors for residents. It's most commonly used in senior living with falls. So there's different systems within AI that they can say, okay, the residents' behaviors maybe at night has changed. Maybe they're getting up to go to the bathroom more frequently, or this is happening. Their patterns of activity is changing, and they can give you reports that say this is someone that you need to look at because this may be a predictor for falls within that residence. So those are different areas we're exploring in regards to AI. I think you have to pick what has value in it, and some of it may not have as much value. And so determining that will be important for us. And as far as virtual healthcare, like I said, this is only the beginning. So I think, the future of expanding the visits and the offerings of it as Sanford develops, that will be awesome. So it's a pretty cool part of being partnered with Sanford.
Yeah. And this is TytoCare, right? That's what we're kind of talking about. And that's what the resident would call if they had an issue, right?
Well, so the TytoCare is the advanced practitioner portion of it. And so that is an interactive system where the nurse practitioner or physician's assistant can actually interact with the residents, listen to their lung sounds, do an actual physical assessment that you would do in the clinic right there in the comfort of their home. So rather than going out to the emergency room and getting exposed to all the other germs, spending hours up at night sitting in a waiting room, they can be in the comfort of their home and have this assessment done. That provider can order medications if needed, send those directly to the pharmacy. They get delivered out to us, and everything kind of flows very smoothly without them having to go out and deal with those external stressors.
Yeah.
And our staff initiate that. So it's nothing that the have to do on their own. I know technology can be kind of scary sometimes. So our staff are right there with them to help walk them through that process.
Wow. Okay. So it's something everybody's kind of familiar with on the floor, if you will, and their doctors are aware of it. The residents know how to use everything. It's kind of a whole package situation out there. So how do people reach out if they want more information? Can they come stay with you guys? How does it work?
Yes. So, thank you for bringing that up. So we do have a couple different options. Of course, we have our independent living, and that's there. We offer activities. We offer housekeeping services, laundry, if needed. We serve a hot lunch there 7 days a week. And we're building a new independent living. So we'll be starting soon to sign up leases for that. We have our memory care assisted living. And one really cool thing that we're doing with our memory care assisted living is we're offering adult day services. And so when you talk about coming to stay with us, it doesn't necessarily have to be overnight. Monday through Friday, 8 to 5, we have a drop-in for adult day services to give that caregiver some support. And then at assisted living, we have beautiful studio, 1-bedroom, 2-bedroom apartments. If you want some more information, our website is villagewatertown.org, or you can reach out to Dalton. He is our director of senior care sales and marketing, and his phone number is 605-237-8407. And he would be happy just to have you come out and do a tour and see how beautiful our community is.
Mm-hmm. That's what I would say is do a tour, because it's, there's a lot out there, a lot. You guys have a lot going on between all ages, literally. So it's just beautiful. And then the story itself is beautiful, and what you guys have, what you're planning is beautiful. So yeah, pretty great stuff. Yeah. Did we cover everything, you think? Or?
I think so. You brought up the story of the sisters, and that's really important for us to share. We make sure that every new employee that we has hears that story. And so this on our website at villagewatertown.org, you can find a link to a video where the sisters created their story, and it tells about it and the legacy that they want to leave behind. So that's really cool to listen to that and hear that, and even hear their vision from a couple years ago when that video was written to where we're at today, and how some of that stuff is starting to come to fruition. We've also had an opportunity yesterday. I listened to a sister tell some of our new employees about her story too. And it's really inspiring, the vision and mission of the sisters there.
Mm-hmm. Yeah, I've heard Sister Barb talk about it a couple of times covering news over the years, and each time it still is a little, it drives you up a little bit, so definitely good work happening out there. So check it out if you're not familiar. Plus your social media is always pretty active with the pictures you were talking about with kids and everybody hanging out together. So that's pretty cool. All right. Well, anything else, or are we good now? Fancy, are you good?
I'm good.
Are you good? Okay. Krista, we good?
Yeah, no,
All right.
absolutely. We just love to have anyone come out and visit or visit our Facebook site, like you said, or villagewatertown.org and see what we're all about.
Very good. All right. Well, we'll get back to some music here. If you need any more information, then check out the Village of Harmony Hill. We got Krista, Fancy. Thank you both for coming in. We appreciate everything you guys do. And when you got some more information, we look forward to having you guys back in. So,
Sounds good. Thanks, Steve.
you bet. Thank you.
Northeast Radio